Today, we're diving into the effectiveness of digital contact tracing apps during the COVID-19 pandemic. Let's get started.
I'm really excited to discuss this. So what's the main point of the content we're covering today?
Well, there's this recent study from the Lancet Public Health that examines Australia's COVID-safe app, and it suggests
Interesting.
that the app didn't really contribute meaningfully to the COVID-19 response in New South Wales.
Really? I thought these apps were supposed to be a game changer in controlling the spread.
Yeah, that's what many hoped. But the study showed that only 22% of detected adult cases used the app, and it identified far fewer contacts compared to traditional tracing methods.
That's surprising. Did they explain why the app didn't perform as expected?
Well, one major factor was the centralized approach they used, where
Right.
contact data is uploaded to a central database for public health authorities to access and validate.
And that became a bottleneck, I assume?
Exactly. The validation process was time-consuming for public health staff, which undermined the app's potential advantage of being fast and scalable.
So the centralized system actually slowed things down?
That's right. In contrast, countries like the UK and Switzerland used decentralized apps that automate notifications and keep data on users' devices, reducing the burden on authorities.
But was the centralized approach the only problem?
Not necessarily. The epidemic context was also a big factor. In New South Wales, the outbreak was largely under control during the study period, so
I see.
traditional contact tracing was highly effective.
So perhaps the app wasn't as critically needed there as in other places?
Exactly. The study mentions that conventional tracing identified over 40 close contacts per case on average, which is
Wow.
quite high compared to other regions.
In the UK, for example, they had fewer contacts identified per case, right?
Yes, fewer than 2 close contacts per case were identified by conventional methods during the same period in the UK.
So in places where traditional tracing is overwhelmed, digital apps might make a bigger impact?
Precisely. The effectiveness of digital contact tracing depends on multiple factors, including the severity of the outbreak and the capacity of existing tracing systems.
But could low user adoption also be to blame for the app's limited impact in Australia?
That's a good point. User adoption is crucial. If only a small percentage of people use the app, its effectiveness is
Yeah.
naturally limited.
Maybe there was a lack of trust or awareness about the app?
Possibly. The study suggests that better real-world piloting before the app's launch might have improved its performance and increased adoption rates.
It seems there are multiple layers to this issue.
Definitely. Digital contact tracing is a complex intervention involving technology, user behavior, public health strategies, and more.
Right. And in other countries like the UK and Switzerland, they saw more positive results with their apps?
Yes, exactly. The UK's app, for instance, is estimated to have averted hundreds of thousands of cases.
That's impressive. Do you think the decentralized approach was a key factor in their success?
It likely played a significant role. Decentralized apps can be more privacy-preserving and efficient, which might encourage higher user adoption.
But aren't there still concerns about privacy with these apps?
Absolutely. Privacy and data security are major concerns that can influence whether people choose to use the apps. If users don't trust that their data is secure, adoption rates will suffer.
So balancing effectiveness with user trust is essential.
Exactly. The authors emphasize the importance of setting clear criteria for evaluating these apps and developing a common glossary so that experiences can be compared meaningfully.
That makes sense. Without standard metrics, it's difficult to assess what's working and what's not.
Right. And it's like we're all trying to solve a puzzle without agreeing on what the finished picture should look like. So
Yeah.
collaboration and shared learning are crucial.
But here's a thought. Do you think focusing on app technology is the best use of resources when traditional methods are effective?
That's a valid question. In settings where traditional contact tracing is working well, investing heavily in digital apps might not be the most efficient approach.
So maybe resources could be better allocated elsewhere in such contexts.
Exactly. It's about tailoring strategies to local needs and capacities. There's no one-size-fits-all solution.
Ultimately, it's a complex interplay of factors that determines effectiveness.
It really is. And ongoing research and evaluation are necessary to inform future public health responses.
Agreed. Learning from both successes and shortcomings is essential.
Absolutely. And hopefully, these lessons will help us prepare better for future public health challenges.
Well, this has been a thought-provoking discussion. Thanks for sharing your insights.
You're welcome. I'm glad we could delve into this topic together.